and gentlemen, the books is in. The books are in. Yep. They're in. They're here.
Log in to KofiPaisaTV.com and get Spears of the Mossy Volume 1 by Kofi Paisa Research Team, from Spears the Pen Volume 2 by Kofi Paisa Research Team, Spiritual Combat Volume 3 by Kofi Paisa Research Team, One Night Before Bed by Any Harret Sean Calfunny, Kalawa's Trip to the Motherland by Kofi Paisa, From Cocaine to Consciousness by Any Harret Sean Calfunny, As I Learned, We All Learn by Kofi Paisa. Also, if you want fresh merch, go to our online store, Family Connect Apparel, and get all the brands. Also, get our 54 deck of quiz and educational cards available now on KofiPaisaTV.com.
ETM Hotel, Rennie Sean. Welcome in peace. My name is Sean. I'd like to thank everybody for tuning into this episode of Science of Sean. Peace Blackwell, Dave B, Marlon from West Africa, Nusha, Chavis in the building, and Keenan. I know we have some other people that are tuned in, listening, watching, or whatnot. I don't know if Brother Chill, I try to be conscious of if Brother Chill got a show going on. I hope I ain't interrupting Chill Talk, because I'm an avid supporter of Chill Talk on Facebook and also YouTube. So if you're not subscribed to, Kevin MC Chill Herd's YouTube page, you want to go ahead and do that. But also you want to make sure that you got, you're on Facebook, that you following Kevin MC Chill Herd. Speaking of which, man, I need to start all my shows off like this, especially speaking about that. So we're gonna revisit some information. We're not really revisit. We're just gonna deal with recent information, but we're gonna basically revisit, right? This thought, a conversation that we started once before, and a little presentation that we did once before. So give me 1 second here and let me get my stuff lined up, and we're gonna deal with something that's crucial, right? And we're gonna go in, and tomorrow we're gonna do what we're gonna do tomorrow. We're gonna come back and revisit Tuskegee. We're gonna revisit Tuskegee tomorrow, and we're just gonna try to be as clear as we can on Tuskegee. So if you got family members, friends, if anyone like that, that could be, interested or anything like that, right? In the Tuskegee conversation, we're going to revisit it, and I may bring up the presentation. I may not, but there's some other pieces of the information that we need to bring out, but we need to deal with we need to deal with something that people are confusing the heck out of, and that is the title, really, just to be honest. It's the title from the gate. So let me see if I could pull up this information for us, and then we're gonna get right into the show. So hopefully, with all this, that what I'm doing right now, that You know what I mean? People can like the show, share the show. Uh, that you're liking the show and share the show, and we getting people in the building. You know what I mean? Because it's very important. Like what we're dealing with or what we got going on right now is very important, and we need to get as many people in here subscribe to the channel or just educated upon the information that we drop. So we want to make sure we do that. I started my Facebook responses earlier this morning. I had a dude on one of my posts just was uneducated. It's all get out, and just as uneducated as all get out, and had to clear it up. The brother had me chasing a chiropractor over some COVID claims, and that's just not how science works. You know what I mean? He wasn't no epidemiologist, had no work done, none of that stuff. And here we are. We going back and forth with. Well, I'm going back and forth with a brother who's saying, "Where's your lab at? Do you got a lab?" I don't need no lab. I don't need no lab at all. So I might bring that up or whatnot. I see some people in the building, man. Please hit that like button, man, and let's go ahead and get the show started. Like I said, I'm starting this show like this. Feel me? All the way.
Yo, talk to me, Cleveland. Have you not had your shot yet? Really? Are you serious? I know you're worried. You're thinking it's gonna be like another Tuskegee? I get it. They've been doing black people dirty for years. So why wouldn't we be concerned this time? Here's the situation, people. In Tuskegee, they did not give us the disease, but what they didn't do was give us the cure. But by not taking this vaccine, we're Tuskegeeing ourselves. The truth is, if we don't protect ourselves, nobody will. We're at over 150 million people vaccinated. And if your doctor and your mother haven't turned into zombies by now, then you won't either. The truth, man, he got his grip my head. Okay, that's it. That was no. He was like,
I'm trying to balance you so you can hold your head.
Jeff, I can balance my own head.
Appreciate that, Chill, for the public service announcement and all the good work that you do, my brother. You know what I'm saying? You know what it is with me. So let's get into the topic of conversation today. Let me get my screen wider. So the CDC published some information earlier this week, and now you have anti-vaxxers using this information as a way to argue themselves back into a conversation and say, see, y'all got a vaccination. What y'all get a vaccination for? This thing, the vaccine that y'all protect against can't even handle the Delta variant. So let's see. So they're talking about the CDC shares pivotal discovery in COVID-19 breakthrough infections that led to new mask mandates. So really, they don't give you the validity of the article. Man, I wish I could get rid of this stuff at the top. All right, anywho, there you go. All right, so I'm not going to play the video, but I'm going to go ahead and get directly into the article. Now, a new study shows the Delta COVID-19 variant produced similar amounts of virus in vaccinated and unvaccinated people if they get infected, illustrating a key motivation behind the federal guidance that now recommends most fully vaccinated Americans wear masks indoors. Keyword, most fully vaccinated Americans wear masks indoors. We need to make sure that this is being reiterated. Let me see if I could, boom, go there for you. Maybe that'll help some people if by me expanding out the thing that you can see it a little bit better. I don't know. I don't want to zoom in because I don't want to take the content away from people who are tuned in. on their cell phones. So it says experts say that vaccinations makes it less likely that you'll catch COVID-19 in the first place. So experts say that vaccinations make it less likely that you'll catch COVID in the first place. But for those who do, this data suggests that they could have similar tendencies to spread it as unvaccinated folks. Now, y'all see what I have on the screen, right? Just bear with me a minute because I'm looking for a message that I had gotten from who sent it to me. I think it was yeah, they all right. I want to show y'all something. I'm gonna have to put it on the screen, but I need to make sure that I get all my ducks in a row because I want y'all to see what I see. Now, who else sent it to me? All right. So Unbiased sent it to me. Charles sent me an article, which we already got that. Who else sent it to me? Come on now. Somebody else got it up. There's a half an article going around on Facebook, Instagram. You know how the pseudos do. So it's going around like that. And let me stop right here real quick before I go any further in this. And I want to show y'all what I'm talking about. Let me go to my source. Come on, man. Give me. All right, so I'm gonna. Oh, damn, what I want. Open this image. Now, let me put this on the screen. Let me zoom in a little bit. This is from some sister. I don't know. I ain't got this Twitter or Instagram. I don't know. Chef Anki. She says she got the New York Times article, but it originally come, you know what I'm saying? Breaking news. The Delta variant is as contagious as chickenpox and may be spread by vaccinated people as easily as the unvaccinated, an internal CDC report says. Okay, that's one. I'm still trying to find the other one. Where my brother Giles at. I sent him the whole article, but he ain't checked his message yet. He trying to evade me. So boom. Okay, now let me go back and get this one. I want to give it. Boom. So okay. Now I'm finna show y'all two more shots. Okay. And I'm gonna even hunt down this one article, and we're gonna do this live. Right. All right, open. Okay, so my brother put this on his day post. It's now let me try to see if I could track his second source down. Natural News is from Natural News. Right? So now I'm gonna look up Natural News. And I'm gonna go to Natural News website. That looked like spam. Is the dude named Michael Adams? Anyway, I ain't found this website yet. I ain't about to waste my time on it. But anyway, this thing comes from Natural News. It says the top news place, and it says CDC confesses, okay, vaccines are failing and that the vax can be super spreaders. The CDC never says any of this in the title, but yet our brother does it. But I'm crazy. That may be true, but I ain't stupid. Go read the data and turn off the damn TV. Right? So it says, now I'm gonna put the title in Google and I'm gonna search it. CDC, but I'm gonna do it on my phone so I can get to it faster. Confesses vaccines failing. Excuse me. Found a website. This article was published 23 hours ago. And if you listen to right, they're selling something on the website. But I wanna look at this article, the one that he got up. Let's do this live. I want that. CDC says. Oh, confesses. My bad. Watch this. We're doing it live. CDC, CDC, CDC. Watch this. Boom. All right. Look at the build of the website. They're selling stuff. See? You see how the ads pop up? This the dude right here. This the same dude that's in the screenshot, right? Well, it look like him. Anyway, so Mike Adams. Does an article say Mike Adams somewhere on here? Say somewhere. I don't know. We gotta keep reading. But this thing says via the words of CDC's own director. Okay, so it's a money grab. It's a race. Says CDC vaccines are failing. Vax can be super spreaders. Demand return to mask mandates for everybody. It's one of the play articles because it comes from Natural News. That's what it says. So I'm gonna go back. I'm gonna look again, and I'm gonna go to Your News. Same one. It's the same dude. All right. So there must be like a little website or something like that, like a little blog site where they getting, you see what I'm saying? Where they getting that little background that he had on his image. But let me see if it gives me the source to take me back to the original. Find a new podcast. Look, they even got Malone on there and everything, yo. All right, so he did it. Now we got these images up here twice. And then he also shares that same little snippet right here. Delta variant more contagious, blah, 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 but nothing else. Okay. All right. So let's get back to the get back. The article go. All right. This is how fast misinformation spread. This is how fast misinformation spread. Yeah, the website is an anti-vaccine website. Natural News, that's the name of it. And the person name is Mike Adams. And if you go look up Mike Adams, Natural News, it's a far right vaccination conspiracy theory fake news website. Okay, hold on, I gotta do it again. I'm just trying to keep people up to par. Because this is where the information come from, right? So you got to deal with the information as you get it. Natural News, formerly News Target, which is now separate from a sister site, is a far-right anti-vaccination conspiracy theory and fake news website known for promoting alternative medicine, pseudoscience, and far-right extremism. Okay? See? Fake news blog. Fake news blog. So, you know, we're going through that process and we're trying to get rid of this information immediately. Can I get some likes, family? Can y'all hit the like button for me? Can y'all hit the like button for me? Can you subscribe to my channel? Can you hit the like button? Can I get some subscribers? Come on now, rock with me, mess with your boy. So immediately, bro was out the door for promoting that stuff, and he's doing it on his Facebook. But this is how fast that misinformation spreads. It's how fast. Now let's get back to the lesson at hand. Sorry for all that. I had to do that. But I do that when I get to reading articles because I'm about to show y'all where these people be messing stuff up. So it says high viral load suggests an increased risk of transmission and raise concerns that unlike the other variants, vaccinated people infected with Delta can transmit the virus, Dr. Rochelle Walensky says, right? In a study published, the CDC describes 469. But listen, this is what all of this is about. There was a study published on Friday described 469 Massachusetts residents who were infected in July outbreak, which included summer vacation destination for Provincetown. No deaths were reported among them. However, 74% of the 346 cases of 469 people had been fully vaccinated. Of those cases, 79% reported symptoms. Genetically sequenced cases revealed the Delta variant as the main culprit. The researchers found evidence that the viral loads were similar among 127 fully vaccinated people and 84 others who were unvaccinated, partially vaccinated, or whose vacation status was unknown. Vaccination status, dang, my bad. Vaccination status was unknown. So let me repeat that. The researchers found evidence that the viral loads were similar among 127 fully vaccinated people and 84 others who were unvaccinated, partially vaccinated, or whose vaccination status was unknown. Viral load is a proxy for how likely someone might be to transmit the virus to others. Now, on Tuesday, Walensky previewed these findings while unveiling guidance that people in the areas with high or substantial COVID-19 transmission should resume wearing masks indoors. Over 75% of the U.S. population live in these areas. The Delta variant, finding that the Delta variant resulted in similar viral loads was pivotal discovery leading the CDC updated mask mandates, which they came out with on Friday. Excuse me. Now, not to get much more into this particular article, they began to snip something from those news articles that starts here. Okay, here's the news clipping, and here's where they snip it at. On Thursday, CDC internal document said the Delta variant was roughly as transmissible as chickenpox, whereas an early strand was closer to a common cold. This means that under certain conditions, an infected person may have transmitted to 2 other people on average early in the outbreak. But now with Delta, that number could be 5 to 9 times, right? So we talked about that the other day, how the Delta variant is more transmissible, and you got this, that, and the third. All right. So okay, there we go. Now, it's one of the most transmissible viruses we know about, measles, chickenpox. They're all up there, she said. She goes on to say, but even with similar viral loads, it's not a foregone conclusion that vaccinated people are necessarily as contagious as unvaccinated people. She said, this is intriguing data. It's important, but I'm not positive that you're equally as infectious if you're vaccinated. I'm going to say that again real slow. This is intriguing data. It's important, but I'm not positive that you are equally as infectious if you're vaccinated. All right. Now, that comes from Dr. Gandhi, an infectious disease specialist at the University of California in San Francisco, who was not involved in the research. Now, Gandhi said there are multiple parts to immune system, right? And then she goes and explains the antibodies and the T cells, and then raise questions about viral load, measuring the PCR test, and how contagious someone is. And then in a new report says microbiological studies are required to confirm these findings of similar viral loads among breakthrough infections. It also notes that asymptomatic breakthrough infections might be underrepresented because they are less likely to be detected. Now, early in the week, Walensky said that ongoing outbreak investigations will help uncover more about what happens when these breakthrough infections do occur. All right, now, even more reason to get vaccinated. Even more reason to get vaccinated. Even with Delta, COVID-19 vaccines still reduce the spread of the virus. Moreover, vaccinated people are far less likely to end up in the hospital. The CDC internal document estimated that vaccines reduce the risk of severe disease or death tenfold or greater, and they reduce the risk of infection threefold. Getting vaccinated continues to prevent severe illness, hospitalization, and death, even with Delta. Among the Massachusetts residents in the latest study, none died and only 5 were hospitalized. Of those 5, 1 person was unvaccinated and had underlying medical conditions, and 4 were vaccinated. Among the vaccinated group, 1 had received Pfizer and the remaining had Johnson & Johnson. The vaccinated individuals range from 20 to 70 years old under the underlying health conditions. Now, 2 had underlying health conditions. Remember the data, Moderna, over 80% against the Delta variant. Pfizer, 64. Johnson & Johnson, like in the 50s. Now, additional infections were identified among visitors from at least 22 other states who visited between July the 3rd through the 17th. Thousands gathered for the summer festivities, and infected people reported going to densely packed indoor and outdoor events and venues inside bars, restaurants, guest houses, rental homes, etc. Now, although these findings motivated the CDC to update its guidance for areas with higher levels of viral transmission, the study notes that the Barnstable County was not one of those areas until the outbreak. Now, between the 3rd and the 17th of July, daily news cases rose from 14-day average from 0 to 177 cases per 1,000 residents. The study suggested even jurisdiction without substantial or high COVID transmission might consider expanding prevention strategies, including masking indoor public health settings, regardless of vaccination status. Make sure. All right, so I'm gonna leave that right there, and I want to go to I don't know why this showed up. I want to go to the CDC. Well, not CDC yet. We won't get there. All right, so I want to talk about, again, the Delta variant. Now, of course, y'all already know in the description of this video, I have all the sources for everybody who want to pull the links, research certain things for yourself. Or if you want to share the information on Facebook, you'll have it, or Instagram, or wherever y'all share y'all stuff at, if you share anything at all. All right. Now, how dangerous is the Delta variant? Okay, we need to understand that. We talked about this before when I did a presentation on the Delta variant, but we want to revisit some information just so that we could be a little bit more exact. So this was published on the 23rd from American Society for Microbiology. Okay. This is specifically geared toward the Delta variant. We already know some of this at the beginning. The Delta variant sprang up in December 2020, quickly spread all over. The Delta variant looked like it merged with the UK variant. You get this powerful thing going on. So we know that it ended up in countries in India, Scotland, and the UK, Israel, and of course it's in the United States. It's now responsible for more than 83%. There's some data that suggests it's 90% in the US. It says being reported in the US, and with only 48% of the total US population fully vaccinated, this causes for concern. And remember, 48 is fully vaccinated, but it's like 54 or 56% that are between shots. Now, so how contagious is the variant? Data indicated that the Delta is 40 to 60% more transmissible than Alpha. almost as twice as transmissible as the original Wuhan. Further significantly more viral particles have been found in the airways of patients infected with the Delta variant. A Chinese study reported that viral loads in Delta infections were 1,000 times higher. All right. And WHO regards Delta as the fastest and fittest variant so far. Now, is the Delta variant more dangerous than other variants of concern? According to surveys conducted in the UK, the Delta accounts for 90% of current COVID cases. Symptoms of the Delta tend to be a little bit more different than other strands, but that does not necessarily mean the associated symptoms are more severe. You still get fever, headache, sore throat, runny nose are common, while cough and loss of smell and taste are not. Other reports link, smell, not taste. Other reports link Delta to more serious symptoms, including hearing impairment, severe gastrointestinal issues, blood clots leading to tissue death, and gangrene. Those are new symptoms, okay? Those are not the symptoms that we have even mentioned when we talked about COVID initially in previous shows that we did on the Mossy Warrior Clan with the Science with Sean episodes. All right, we never talked about this. So I'm gonna say this again. We never included hearing impairment. We did mention some gastrointestinal issues, but we did not talk about blood clots or tissue death regarding gangrene. Right? Man, what you mean everything? Boy, you better hit that thing on there. Now, research is ongoing to determine if Delta infection is associated with an increased hospitalization and death. One early study assessing the risk of hospital admission in Scotland reported that hospitalizations is twice as likely in unvaccinated individuals with Delta than unvaccinated individuals with Alpha. Case numbers and hospitalizations are up again and on the rise due to Delta. And then you have the CDC reporting information that the COVID cases, an increase in new COVID cases are up to 69.3% over a 7-day average, and 35% increase in hospitalization over a 7-day average. Still, it is difficult to determine whether Delta is actually making people sicker than previous forms. Now, what Delta has done is provided some new symptoms that we did not discuss before. German crazy. Now, would a vaccine remain protective? All right. Studies show that 2 doses of the vaccine are effective at preventing hospitalization and death, but neutralizing levels of vaccinated sera are lower against the Delta variant compared to the original strand. All right, so there's an article published in the New England Journal of Nature, which tested the neutralization activity of the sera. And we'll get to that in a minute. And I'm sorry I didn't have that up for y'all, but I have this article so you can go in there and do this, right? So you can go in there, you can click on the article and get this information immediately. I gave you the source, and then I just showed you all you got to do is click on that, and it's going to take you right over here. And you can deal with that, which was published on the 7th. And we actually have this in one of our chats. So hold on 1 second. Let me get back to my screen. All right, there we go. Now it says here, the B16172 virus. Now, the data from the study indicated that on average, all right, the Delta variant was 2.9 times less susceptible to neutralizing than the Wuhan strands, but most convalescent serum samples and all vaccination serum samples showed detectable neutralization activity. As a result, researchers concluded that immunity conferred by mRNA vaccines is likely to be retained against the Delta variant. These results were supported by further research in Nature against monoclonal antibodies, convalescent sera, and sera development after vaccination. Study found that some antibodies targeting the terminal domain, the receptor binding domain of the spike, showed impaired binding and neutralization of the Delta variant. Now, additionally, convalescent sera collected up to 12 months post symptoms from individuals who had recovered from natural infection. Okay, now were fourfold less effective in neutralizing the Delta. Now, somebody had asked the question. The brother that asked the question, his name was Jay Vudon on the post. So I'm gonna read this again. Additionally, convalescent sera collected up to 12 months post symptoms from individuals who had recovered from natural SARS-CoV-2 infection. All right, Wujawu, if you're in the chat, you're listening, were fourfold less effective at neutralizing Delta than Alpha. Sera from individuals who were partially vaccinated had one dose of Pfizer or AstraZeneca showed little to no neutralizing activity against Delta. Sera from 95% of those who received 2 doses of either vaccine generated a neutralizing response that was 3-5-fold less potent against Delta than Alpha. So you natural infected people, you are still more susceptible than those of us who are vaccinated. And you can get some other symptoms, potentially. Now, another study published in the New England Journal of Medicine used the test negative case control to estimate vaccine effectiveness against a symptomatic disease caused by the Delta variant. Study was conducted in the UK, 88% effectiveness against the Delta after 2 doses of mRNA, but only 30.7% efficacy after 1 dose, which is below the FDA standard of 50%. Y'all with that? Y'all catch that, right? Okay. Now, in initial reports for J&J, however, a new study, not yet peer reviewed, indicated that the significance of the fraction of vaccinated individuals showed 5-7-fold decrease in neutralizing titers, which, according to the study, mathematical models could result in a decreased protection from infection, which it does. Taken together, this data supports important full dose vaccinations against SARS-CoV-2, but reports reduced vaccination efficacy against Delta, warrant investigation into breakthrough infections and possibility of vaccine booster shots. Genomic analysis of isolated 63 vaccine breakthrough infections in India, not yet peer-reviewed, revealed that the Delta variant was the predominant lineage in groups who were partially and fully vaccinated with either AstraZeneca or Covaxin. Both vaccines I am not a fan of based on the data. Now, further research into breakthrough infections that occur in mRNA vaccines is needed. Okay, so we go on down to mutations of the Delta variant, and we can actually get into that regarding the you see it, the N501Y. Y'all should know what this is. This like typical next strand stuff that we dealt with as far as the lineages and the mutations. All right, now this is a really good article, right? When you slow it down and you get to reading and understanding certain things, this article is really, really, really convenient. It talks about the receptor bindings and the mutations and all of those things. I don't want to get too far off track. I want to stay right where I need to be. So stopping transmission is key to controlling variants. All right. One way to do that is to mask up, get fully vaccinated, keep your distance, curb transmission, right? It tells you right here, the last thing, vaccination is the best weapon in the fight to curb transmission. I really don't have to say much of anything else. Get vaccinated. Continue to wear your mask. Wash your hands. Protect yourself. Keep your distance. You're indoors, mask up. We don't know what these people are doing. We got to be the smart people, right? All right, so, and then this mentions the Lambda variant, which we're not going to get into. All right, we already showed that in the source. Now, another part here, 3 things you need to know about the Delta variant. These are already things that we've already dealt with. Point 1 was, and I'm not going to read all of the inside. The Delta variant is more contagious. People who are infected with the Delta variant may get sicker. And vaccines, COVID-19 vaccines offer the best protection against the Delta variant. Those three things that we know of, and based on everything else. Now, there are some points made here that I do want to mention. Wearing a mask over your nose and mouth will, while you're spending time around people from other households, they want you to do that. Keep your distance. They want you to do that. Washing your hands. They want you to do that. Steer clear of crowded indoor spaces, including poorly ventilated ones. Paying attention to local COVID-19 infection rates, including Delta variants, and avoid unnecessary social contact with others when infection rates surge. So we need to chill from going to the club and being in these packed restaurants or bars, thinking that we're going to live a high life and all that. And, you know, Netflix and chill, cook a romantic dinner, cut your TV on downstairs, watch a movie, kick your feet up, fall asleep on the couch. You know what I'm saying? Invite vaccinated people over, fully vaccinated people, something like that. Pull out the Monopoly. All right, so let's get to the CDC. So in summary, the CDC outbreak of SARS-CoV-2 infection, including COVID-19 vaccine breakthrough infections associated with large public gatherings. Y'all wonder why we having breakthrough infections? Here you go. Large public, associated with large public gatherings. And this is the study that was mentioned earlier, Barnstable County, Massachusetts, July 2021, right? We already read it earlier in the actual article, so we don't have to go through and get through all of that, right? But what we're going to do is we're going to go and deal with something a little bit more specific regarding the CDC. Okay, so me and Chavis was thinking the same thing earlier today. At really around the same time. I'm not going to say he was before me or I was before him, because we both was like on it, like, okay, CDC information. We see that people are trolling. We see people spreading misinformation. What we're going to do, we're going to combat the misinformation without arguing with people. So we go get the slides from the CDC. So this is the information that was presented on the 29th. It says improving communication around vaccine breakthrough and vaccine effectiveness from the CDC. All right. So in the first slide, you have vaccine breakthrough cases may reduce public confidence in vaccines. Now, the reason that they're saying this is because we fully vaccinated people, we want to be out. We want to go back to clubs, bars, movie theaters, you know, birthday parties. We want to do the things, we want to get back to life as normal as possible, as quickly as possible, regardless of the fact that there's a mutation, there's a mutating virus that's going around. These are the things that we want to do. And really, it's not serving a purpose because, you know, we have these people out here that aren't vaccinated that are also in our presence, right? So our events are not with other vaccinated people. Our events are with vaccinated and unvaccinated or partially vaccinated people who may have who are more susceptible to breakthrough. Now, when you think about breakthrough vaccines, right? You don't know who's had what vaccine. So when you just hear a breakthrough, you're like, ah, man, the vaccines are not working. That is not true. That's the furthest thing from the truth. And okay, I see Sutek in the building and Kofi in the building. What up? Omar, what up? What up, Pure? Keenan, what up? What up, everybody? All right. Yeah, so, you know, that's where we are with that. Now, in its 3 bullet points, the CDC states that vaccine breakthrough cases are expected, which we all know no vaccine is 100% effective. The mRNA vaccines are 94 and 95% infectious against, you know, they're infectious and safe. We know that data. Right now, increase as proportion of total cases of vaccine occur. Now, vaccine breakthrough cases will occur more frequently in congregated settings and in groups at risk of primary vaccine failure, which are people who are immune compromised and the elderly. Remember, the breakthrough cases that we dealt with 2 weeks ago were in people who were 65 and older, that were more susceptible, and they were women, and the majority of them uh, were women, and then the other ones were some men, and then you had people below the ages of 50 or something like that. So I don't remember the data specifically off the top of my head. However, we know it exists. Now, communication challenges have been associated with increasing proportions of cases vaccinated, even when vaccination effectiveness remains stable. So there's some issues there. You have public convinced vaccines no longer work or booster doses needed. When you start hearing people like Pfizer, BioNTech come out and say, well, we want to give a booster shot. They want to give a booster shot, not only for the bag, and not for the bag, but for performance. They're trying to compete with Moderna. Moderna's vaccine is working well against Delta, right? We have statistical data, shout out to Derek, that I can show y'all that shows that Moderna was 0.0009% breakthrough infection rate in LA County, whereas Johnson & Johnson and Pfizer was higher. Okay, so we have the actual data like that, and we're getting small sample sizes of data like that from each county that does report the specifics. Now it says greater risk of disease, hospitalization, and death among unvaccinated versus vaccinated people. I want you to pay close attention to the chart. This is per 100,000 people. Okay. The blue is the fully vaccinated people. The green is the fully vaccinated people, and the green is the unvaccinated people. All right. Check it out. So in 8-fold reduction, you have 178.6% per 100,000 people, disease incidence, right? Versus 21.14% in the vaccinated group. There's still a huge discrepancy, right? So we have to look at this through clear lenses, because we're getting all this information and people are misinterpreting the data. So hospitalization incidences among the vaccinated, you have a 0.1%. Among the unvaccinated, you have a 2.52% of the people per 25-fold. Look at that. You had 8-fold, now you got 25-fold. That's a huge amount of people that are having to go to the hospital. And then deaths, you have a 0.04% rate in the in the vaccinated, and then you have and then you got a 0.96%, which is also 25-fold in the unvaccinated. So moral of the story here is the unvaccinated people are being hospitalized more. More deaths are occurring in the unvaccinated people, and hospitalizations are occurring more in unvaccinated people. So overall, that 96 to 97% of the people that are in the hospitals dying and things of that nature, being hospitalized and having these disease incidences, are still occurring more in unvaccinated people. Now, at current incidences, 35,000 symptomatic infections per week among 162 million vaccinated Americans. 35,000 symptomatic infections are happening per week among 162 million vaccinated Americans. So you have an increased percentage of vaccinated persons among the hospitalized and COVID net. All right. Now, of course, you have the 2 bullet points. One reflects the increase in vaccine coverage, the other one in higher risk among older age groups for hospitalization, death, and relatively young people, regardless of vaccination status. So in January, right, we began to see that spike that took place. And you have in the gold, you have people who are fully vaccinated, and in the blue you have hospital deaths who were fully vaccinated. Okay, now when vaccination cases begin to pursue, you begin to see like this thing kind of like go up a little bit going into May and then leveling off. But like I said, the blue represents hospital deaths who were fully vaccinated, and then the hospitalizations who were fully vaccinated. So we see a little spike, 15.1% in increase in deaths from people due to breakthroughs and stuff like that. So let's go. And we know that's over the age of 65. So CDC uses multiple platforms and studies to design, monitor COVID-19 vaccine effectiveness, VE. So the priority here for vaccine effectiveness is infection and transmission. So what they did and what they continue to do is to design prospective cohort among healthcare personnel and frontline workers, transmissibility evaluations, and congregate settings, case ascertain household cohorts for transmission. Against non-severe disease, test negative designs, control among outpatient electronic health records. Now, here's the issue that I have right here, is that we have a community of people who may be infected with SARS-CoV-2. Grandma calling me. Now, we have a group of people who may be infected with COVID, right? But they won't even go get a test to determine if they're positive or not. They also have an emphasis on severe hospitalizations with the same metrics, the TND, and older adults, including nursing home residents. All right, remember, y'all heard me. Case control among adults, less than 65 years of age. They're dealing with that. And then all the other data down at the end is also captured above. All right, so they got some results here. So in the early evidence in healthcare providers that vaccinations may reduce transmission and intuitive illness, between December of last year to April 10th, the vaccine effectiveness against infection was 91% among fully vaccinated people, 81% for partially vaccinated people. Okay, so there was some success there between December 14th and April 2021. Now, compared to unvaccinated cases, vaccinated cases for full or partial had, peep it, 40% lower mean of RNA viral load, shorter mean duration of detectable viral RNA, lower risk of febrile symptoms, shorter mean of duration of symptoms. So everything was lessened in the vaccinated crew. Now, preliminary vaccine effectiveness estimates assessing duration of protection for 2 doses of mRNA. Vision, test negative design across 8 integrated healthcare systems, data through the 22nd of June. The VE against hospitalizations was 88%. No evidence of waning immunity to 16 weeks post second dose. No evidence of waning immunity. All right. Now, IV3 test negative design across 21 hospitals. That data through June 21 showed an 87% VE against hospitalization. There was no evidence of waning immunity through 20 weeks per second dose. All right. And then in healthcare personnel, test negative design across 33 sites, May 31st information. The VE against symptomatic infection was 90%. So 90% of the healthcare personnel was holding strong. Now, there was no evidence of waning immunity through 14 weeks post second dose. Now, lower estimates of VE for mRNA vaccines among immune compromised populations with published evidence here, with 71% against SARS-CoV-2 infection between days 7 and 27 days after the second dose of Pfizer for immune compromised people versus 90% for the overall, 80% against SARS-CoV-2 infection after 7 days after the second dose of mRNA vaccine for people who are immune suppressive. Now, 75% against asymptomatic COVID 27 days after second dose of Pfizer, and 59% against hospitalizations among the immune compromised. Now, remember, after the second dose of mRNA, Remember, immune compromise is a big deal because they're not gaining those antibodies. What y'all talking about? I don't know. I don't know. I don't know what y'all talking about. All right. So it is what it is from that perspective. So immune compromised conditions were recipients with hematopoietic cell or solid organ transplant, patients under immune suppressive therapies with asplenia and chronic renal failure or eye failure, advanced kidney disease, dialysis, or nephrotic syndrome. All right, now lower estimates of mRNA vaccine effectiveness among nursing home residents. The VE of mRNA vaccines for any infection, including asymptomatic, was 65 to 75%. Different locations and platforms from December to May. The NHSN was 70% with Pfizer and BioNTech, 65% from the ages of 51 to 75 from Moderna. Signature Healthcare was 74% between 54 and 85 years of age for mRNA vaccines. LA County reported 75% effectiveness from 43 to 89, ages 43 and 89. Why would a 43-year-old be in nursing home? Okay, whatever. Now, vaccination effectiveness and breakthrough examples using the screen method, right? Using the screen method. This thing's going. So recent nursing home outbreaks for the beta variant for VE estimated that 61% against infection, 75% against mild illness, 85% against severe illness. The vaccines was going. Boom, 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 was popping on the virus right through this gap. Now, vaccine breakthrough in the LTCF residents where coverage is 80% nationally. Now, for infections with the VE was 61% of the cases were vaccinated. Mild illnesses was 50% and severe illnesses was 38%. All right. So even in breakthrough, you had this strong stance. Now, communication challenges around the VE and differential risk. I'm gonna see if I can put this together. So vaccines were more effective against hospitalization, death, illness, and infection, according to what we just witnessed. VE estimates represent an average group rather than individual risk, like risk modified by age, immunocompromising conditions, etc. Need to clarify messaging and individual protection. I don't know what they mean by that. Now, how do we communicate this differential risk to the public? You have to use comparisons to unvaccinated that are relatively stable, personal stories, and examples from outbreaks. Now, this is why I said, let me see if I can put this together, because this is not my presentation. This is the CDC's presentation. So what have we been doing on social media to combat misinformation is we have been comparing the data from vaccinated to unvaccinated, right? Using information that shows that, hey, this amount of people in the vaccinated group aren't experiencing these conditions that you are. And then we dealt with personal stories, anecdotal accounts. But now the anecdotal accounts are overwhelming because the scientific data is showing that we have patients in the hospitals who are on life support, are almost on their way out, and that are experiencing some of these illnesses in the unvaccinated group who are telling their stories saying that go ahead and give me the vaccine now, and it's too late. And so, a lot of lives are being lost because it's too late to get them a vaccine, and the vaccine does not work like that. I don't know what y'all talking about. And then examples from the outbreaks, we've been doing a great job providing examples of outbreaks. Now the CDC, this is a governmental level. They're trying to do an outreach program to combat misinformation and to reassure that mRNA vaccines are the way. Correct. The unvaccinated people are getting knocked off. They're part of the problems. So it's not really us. All we have to do is continue to show the data. So when they come up with these little headliners, these little news clippings, we got to deal with those little news clippings and say, you're not giving people the full context. So when we got people only showing half a screen, right? Like, hold up. When we got people doing this, right? When we got them doing this or this, right? On Instagram, Facebook, wherever they doing that at, we have to be more assertive and say we need to give the people the full context of what the CDC was saying. We can't allow them to get away with this. They can't get away with this. We have to be more direct, like, bro, listen, here go the full article. Now it says this, and then it goes on and it says this. You're trying to one up somebody or get a quick little hee hee ha ha moment, and but what you're doing is you're putting people at jeopardy. All right. So now the Delta variant, of course, the CDC talked about it on Friday. They talked about the transmission of the variant versus the ancestral strand. We see that it's more stronger than it's more deadlier in all of those phases. But look what other diseases that they actually have up here going on. Look, MERS, bird flu, Ebola, polio, Spanish flu, SARS. They got all of these different things going on. So we see something that's faster. We see something that's more deadlier. And then we see over here, it says the Delta variant is more transmissible than MERS, SARS, Ebola, common cold, seasonal flu, 1918 Spanish flu, and smallpox. One more time. The Delta variant is more transmissible than MERS, SARS, Ebola, common cold, seasonal flu, 1918 Spanish flu, smallpox. The Delta variant is as transmissible as chickenpox. Your kids don't even know what chickenpox is. But if one person in the hood got chickenpox, everybody in the hood got chickenpox because we all was in the same areas. We went to the same schools. We played on the playgrounds. We touching some of the same things. We're unsanitary. We really ain't washing our hands like that. The whole 9 yards when we was project babies. The Delta infection is associated with higher viral load and duration of shedding. And remember when I told y'all earlier about viral loads and shedding? Remember we talked about virus shedding, right? See, I just wanted to let y'all know before the CDC came out and started talking about viral load and shedding, we was already ahead of the game, right? They said the ancestral strand was 13 days of viral loading and shedding. That's why they gave you 2 weeks. They're talking about a medium of 18 days versus 13 days. The Delta variant has 18 days. So guess what? If people get the Delta variant, they need to quarantine for 3 weeks. But they're only doing 10 days. And if they go get tested, they're going to still show positive. You said, where's this source? Hold on. This source from the CDC. But this source also is what Chavis put in the chat earlier. He put it in the chat earlier when before the show even began. Where he actually used the Washington Post, but whatever. Like I said, if you look in the description, all my sources are in the description. All my sources. Even what I'm showing right now on the screen, what I have on the screen showing right now is in the description of this video. What I'm showing right now is in the description of the video. I don't know nothing about Unc being live, yo. Oh, okay. I can see where people running and gunning and all of that. None of my business. I'm gonna keep it going. All right. So the risk of the Delta variant may be higher compared to the Alpha, but only if prior infection, 180 days. Listen, risk of reinfection with the Delta variant may be higher compared to Alpha variant. Now, this is something that Jay Boudon also talked about, the risk of reinfection. The risk of Wujawu, are you listening to me? The risk of reinfection with the Delta may be higher compared to Alpha variant. Go get vaccinated, Wu. Go get vaccinated. Now, but only if prior infection is less than 180 days, well, 180 days earlier. And a lot of people have been infected. They've been infected 6 months ago, 8 months ago, still ain't got the vaccine. So you're susceptible now of being reinfected with a different variant. So we don't need to play no games here. We need to deal with what we need to deal with. All right. Now, the Delta variant vaccine breakthrough cases may be as transmissible as unvaccinated cases. All right. So the breakthrough cases reported to national passive surveillance have lower CT values by 3 cycles, tenfold increase in viral load, right, compared to alpha. Now, the Barnstable County, Massachusetts outbreak, no difference in mean CT values in vaccinated and unvaccinated cases. We done went through that already. Now, the Delta variant may cause more severe disease than alpha or ancestral strand. In Canada, you had higher odds of hospitalization. Singapore, higher odds of oxygen requirement, ICU admissions, or death and pneumonia. Scotland, higher odds of hospitalization. Again, ICU admission in Canada and death in Canada. Pfizer 2-dose vaccine effectiveness versus alpha versus delta. In England, Scotland, confirmed infections, symptomatic disease, and hospitalizations. Now, remember the dots, the little dots, as you can see, represent alpha. The pyramids, the red triangles, they represent delta. As you can see, in England and Scotland, confirmed infection, the alpha is more. Symptomatic disease, the alpha is more. Where they're about the same is hospitalization. In Canada, they're about the same in symptomatic disease. In hospitalization or death, the delta is more. That's crazy. In Israel, it's alpha alpha for confirmed infection, symptomatic disease, but hospitalization or death, the alpha is still ahead, but it's behind. But I don't think that we have all the data. And these are different time periods. Now, given increased transmissibility for lower VE and current vaccination coverage, NPI is needed to reduce transmission of Delta variant. You have vaccination effectiveness 75 to 85%, 50% infection report masking, and then you had no adjustment for other interventions. Yeah, all right. I thought y'all said Uncle's live or something. Now you got natural immunity equals 5%. Natural immunity is 35% in these different levels for model assumptions and no adjustments for other interventions. Basically, your vaccine coverage with no masking, which was in brown, I'm over here in this top chart. No masking represents that top layer. Yellow is mask unvaccinated people, and all masking is right there. As you can see, the likelihood of reducing transmission is there. Now, that's with the alpha. Now, with the vaccinated coverage for the delta, it's look a little crazy over here. Everything is up. It's low here. It's up here, right? And then it's low here. It's up here. Oh, I didn't know. What is he live on? Is he live on? Is he live on what? What he live on? He live on pseudo killers or something? I guess that's why people left. Yeah. He talking some. Man, I ain't involved in that. Let me get back to cooking. Let me cook my meal. I guess that's why people dipped out. I guess I'm boring, you know what I mean? Oh, okay. Yeah. Well, it just let you know right there, you know what I'm saying? Like, you see, we had 24 people in here, then y'all said the Unc was live, so we went from 24 to 15. So, given increased transmissibility, well, they just talking about journals, how to read a journal. So if you want to, you know, doing all that, nah, I don't even care. I support myself. Given increased transmissibility, lower VE and current vaccination coverage, NPIs needed to reduce transmission of Delta. So vaccine effectiveness is remaining around 75 to 85% overall. 50% infections reported. This is saying basically this is telling us right here in red, the hell with everything else is saying, given higher transmissibility and current vaccine coverage, universal masking is essential to reduce transmission of the Delta variant, because this bottom chart that we show right here before they even threw everything up, the Delta variant was increasing rates. The probability of increase was higher in the Delta variant versus the Alpha. So in summary, they broke us down in summary. The Delta is different from previous strands. We know it's highly contagious, more severe, and it causes more breakthrough infections and may be transmissible. Listen, this is what people keep leaving out. May be as transmissible as unvaccinated cases. They do not have a solid answer for transmissibility here. They're saying that it may be. Maybe. Now, vaccinations prevent 90% of severe disease, but may be less effective at preventing infection or transmission. Therefore, more breakthrough and more community spread despite vaccination. NPIs are essential to prevent continued spread with COVID vaccine coverage. Next step for CDC is you know, they got to roll out their communication piece. Yeah, look, acknowledge the war has changed, right? We are at war. There is a new war. I don't know if Unc is or not. Y'all have to call Unc out on that. Man, what are y'all talking about? Y'all tripping. Now, prevention. Consider vaccination mandates for ACP to protect vulnerable populations, universal masking for source control and prevention, and reconsider other community mitigation strategies. I agree with all of that as far as prevention. They blacked out some acknowledgments here, which was probably some source material, and then they provide you with that. That is from the CDC presentation from Friday. All right, so we kind of drug this out a little bit, but I want to come back to my brother Chill heard his video.
Yo, talk to me, Cleveland. Have you not had your shot yet? Really? Are you serious? I know you're worried. You're thinking this gonna be like another Tuskegee? I get it. They've been doing black people dirty for years. So why wouldn't we be concerned this time? Here's the situation, people. At Tuskegee, they did not give us the disease, but what they didn't do was give us the cure. But by not taking this vaccine, we're Tuskegeeing ourselves. The truth is, if we don't protect ourselves, nobody will. We're at over 150 million people vaccinated. And if your doctor and your mother haven't turned into zombies by now, then you won't either. The truth, man, he got his grip my head. Okay, that's it. That was no. He was like,
I'm trying to balance you so you can hold your head.
Jeff, I can balance my own head.
Man, chill, man. That was much appreciated. So, yeah, man, that's the new threat. That's where we are with this thing. You know what I mean? And you know, I know people want to get over there to you know what I mean, and rock it out with the pseudo killers and all that over there. and I want to keep this as bite-sized as possible, so I'm not going to hold people up. Let me, uh-oh. I'm going to put this link in the chat real quick. Anybody want to, if you had any questions, comments, concerns, I don't think anybody really does. Pretty much, I just wanted to make sure that we fully understood what the CDC was saying, that we understood what the news articles had been publishing, that there are new conspiracy conjectures that are going around social media to re-advise people about the seriousness of Delta, and then to, and then to expose where some of the misinformation is coming from. So I think I kind of did that today in this conclusion, because I'm concluding. In my conclusion, because we attacked the misinformation piece. We even exposed one of the misrepresentations and misinformation campaigns. And we actually gave full validity to those clippings that people were using as sound bites to promote their anti-vaccine stance. And then we re-advised the seriousness of Delta, and then we dealt with the CDC's information in its presentation without having to have the CDC, and we got all the sources in the description of this video. So hopefully we got everything together. And we did what we needed to do to make sure that people were there. Tomorrow, we're going to revisit the Tuskegee experiment. We're going to take a look. We're going to have us a literature review. And we'll probably do that Saturday afternoon or evening, hopefully. Saturday evening or afternoon or evening. I don't know exactly when. And if anyone wants to join in on the discussion regarding Tuskegee, that will be the show for you to want to come on and join. But we are in detail. We're going to go through some journals. We're going to revisit. I got the presentation, so we can revisit the court documents. But we need to make sure that our people understand what the damn Tuskegee experiment was, because that's all they think it is. They just hear Tuskegee experiment. And I'm leaving it at that because I want to show people the actual title, that an end all be all. And most people don't know the actual true title. And we'll have a discussion centered around that. So we'll make it a learning experience. We'll build off that learning experience, and then we'll go from there. I am aware that in about an hour, Asar will be live, and he'll be making this argument against some people that said certain things on Sarnetta's channel. Asar's presentation and argument is in response to some people from Sarnetta's channel. It is not from within the house. So again, I think we did a good job at tying everything together. We dealt with the new social media claims that just came out behind the CDC's information. Notice that pseudos are always using the science against us to propagate their positions, and they don't give it clarity or they don't give it context. They just try to clip us to death. So we gave context to those that are out there purporting those things to people on social media. We re-established the importance of understanding the Delta variant, and we dealt with some points from the CDC and their presentation. And on that note, man, I appreciate everybody tuning in. Make sure you go get Beautiful Lessons About Kimoyo by Kofi Paisai. Stay tuned for what SARS-CoV-2 taught me, which probably will be my first book before I do the Islam in the Land of the Blacks, or they might just come out back to back. My goal is if I have if I have the support, because I have to, if I have the support to be able to put it out, then I will be able to put out both books at the same time. And hopefully people will support those books and do everything that needs to be done to help combat some of this because this is not going away. So hopefully you learn from what SARS-CoV-2 taught me. And hopefully, when we get into the coming of Islam in the land of the blacks, from a historical perspective, we get some context around that and we deal with some claims. Yes, the books will be coming out on Same Tree Different Branch Publishing as well. That, as you know, Kofi's book was first up. My book may not come out until after we release volume 4, because I don't want it to come out around the time that we release volume 4. I wanted to respect volume 4's work. Especially we got Chavis Tep Hessup in volume 4 with his works. We got a couple brothers that actually got 2 chapters in there that normally would have done 1. So I want to, they need to get their shine and deal with it from that. Yeah, track and field started. Well, it started yesterday. I watched track and field yesterday. Yep. But on that note, man, I appreciate everybody for hanging out with me for an hour, a little less than an hour and a half. We'll keep this bite size. Hopefully the learning experience in this particular video, damn, Kofi got 12 chapters. Yeah, he really do. Golly. Yeah, I didn't mean for a lot to go on, man. I know F9 is on demand, so I don't have to go to the movie theaters to catch F9 now. I can watch it in my living room. And so I'm gonna try to do that today. If I don't do it today, then I know I'm gonna do it tomorrow. But on that note, man, I appreciate everybody for tuning in. Like, share, subscribe, tell a friend, tell a friend. Please, if you're not subscribed to the channel, subscribe. If you know somebody that's interested in the information or has a problem with the information, share it. You got unvaccinated friends, family members, or anything like that, you need to turn them on to that may need more information to make an informed decision. We can help them. Hopefully we'll be able to hear from our sister. Where's she at? Let me see if she's still in here. Jeremy, where she at? Where Black Will at? Hopefully we'll get to hear from my sister about a COVID experience after a second vaccination and stuff like that. So again, man, I appreciate everybody tuning in. And man, I'm gonna chill this thing out one more time, yo. I'm gonna chill this thing out one more time.
Paris, Mama D, ladies got.
I don't know what that's about, but I'm gonna chill this thing out though.
Yo, talk to me, Cleveland. Have you not had your shot yet? Really? Are you serious? I know you're worried. You're thinking this is gonna be like another Tuskegee? I get it. They've been doing black people dirty for years. So why wouldn't we be concerned this time? Here's the situation, people. At Tuskegee, they did not give us the disease, but what they didn't do was give us the cure. But by not taking this vaccine, we're Tuskegeeing ourselves. The truth is, if we don't protect ourselves, nobody will. We're at over 150 million people vaccinated. And if your doctor and your mother haven't turned into zombies by now, then you won't either. The true man, he got his grip my head. Okay, that was new. He was like,
I'm trying to balance you so you can hold your head.
Jeff, I can balance my own head.